wasting time. So, as we already know, we are covering a series of lectures, and this is our third lecture of this series. And the lecture on our today, on the topic of our class today is maternal and child health part 3, which is about taking care of the newborn. So basically, we discussed about the health of a pregnant female in our first class. Then we discussed the birthing process, the delivery process, and the complications related with the delivery, and just after the delivery, which is called postpartum period. So we discussed all of that in our second class, and now this is our third class on the very important topic again, and this topic is taking care of the newborn. You people already know me. My name is Dr. Omer Farooq Khan. I'm a resident orthopedic surgeon in Pakistan. So the learning objectives for today's class will be introduction, basic definitions, brief summary of previous class. Then we will come to our today's class. We will discuss about initial care of the newborn screening tests and prophylactic measures for several diseases. Then physical examination of the newborn, we will discuss in details. The physical examination of the newborn, we will discuss it in details. Then we will discuss the care of the baby in the first few days of life. Then feeding of the newborns and infants will be discussed. Then dealing with common neonatal pathologies or problems. So, introduction, having a baby is an exciting time that often inspires women to make healthier lifestyle choices and, if needed, work toward a healthy body weight. When a woman gets pregnant, her whole body physiology changes drastically, and there is a rough rush of hormonal as well as physical changes in her body, which can be challenging for many females. Taking care of a mother's health while she is pregnant is extremely important aspect of pregnancy care, as she is not the one individual but two individuals. One is the mother and other is her baby inside her womb. The first 4 weeks of life of an infant are considered the neonatal period. So the baby within first 4 weeks of life is called a neonate or a newborn. During this period, many complex physiological changes occur and the infant interacts with different stimuli. Care during this period should be continuous and effective. Newborn care consists of evaluation of the need of resuscitation, a complete physical exam, administration of prophylactic medications and vaccines, adequate feedings, safe sleep, hygiene of the newborn, and other important areas of baby well-being. So basically, we will discuss all of these things, that how should we take care of a baby, how a healthcare professional or family personnel should take care of the baby, and what signs and symptoms need to be reviewed, and what are the normal things which we should expect in any baby, and what are abnormal things which should not be happening in any newborn. So basic definitions, we already know what is pregnancy. Pregnancy is a condition during which one or more offspring develops inside a woman's uterus. A multiple pregnancy involves more than one offspring, such as with twins. Pregnancy usually occurs with sexual intercourse, but can also occur through assisted reproductive technology procedures. Conception and trimester, we already discussed. Then we are coming to the new terminology, and the terminology at first is neonate. A newborn infant or neonate is a child under 28 days of age. During these first 28 days of life, the child is at highest risk of dying. So a newborn infant or neonate is a child under 28 days of age. During these first 28 days of life, the child is at highest risk of dying. And newborn reflexes are your body's involuntary muscle responses to stimulation. Certain actions or sensations produce specific muscle reactions. That means your baby isn't controlling the responses. They are happening automatically without your baby trying. So basically, these reflexes are a measure of the maturation of the nervous system of any newborn baby. All of these reflexes are very, very important to understand and to grasp so that we can assess the neuronal development of any baby. Infant is the term which refers to a baby from birth to around 1 year of age. You may also use the term baby during this time. So basically, if a child is under 1 year of age, we call him or her an infant. And if a child is under 28 days of age, then we call it a newborn. Fetus. A fetus is an unborn offspring that develops and grows inside the uterus womb of humans and other mammals. In humans, the fetal period begins at 9 weeks after fertilization of an egg by sperm and ends at birth. So, brief summary of previous class. As you already know what we discussed in our previous class, we understood the concepts of understanding the signs of onset of labor, when to go to hospital. All three stages of labors were discussed in detail. Water birth and assisted deliveries, monitoring of the baby during labor was understood. Care after NVD and C-section births was talked about. Postnatal visits and their routine was discussed in detail. Changes in body after birth. We discussed a lot about what kind of changes in the body of a pregnant woman after giving birth occur, common postpartum complications such as hemorrhage or depression, and how to avoid them. Yeah, we did discuss common postpartum complications such as postpartum hemorrhage or postpartum depression. We call it PPH or PPD in medical terminologies, and we did discuss how to avoid these complications. So, coming towards today's class, so today's class is all about newborn, newborn, newborn. So, taking care of the newborn is our today's class theme. In this section, we will discuss all the details regarding immediate and delayed care of the newborn. As pertaining to our lecture series, so basically, we are talking about maternal and child health. So, definitely, without talking about the care of the newborn, and it will be injustice to our topic, it will be injustice to this lecture series, so we have to discuss the care of the newborn as well. So, initial care of the newborn. During childbirth, the fetus, which is immersed in amniotic fluid and totally dependent on the placenta for nutrition and oxygen, makes a major transition to a newborn baby that breathes air and takes in nutrition by mouth. Immediately after a baby is delivered, the doctor, midwife, or nurse attending gently clears mucus and other material from the mouth, nose, and throat with a suction valve. The newborn is then able to take a breath and no longer needs to receive oxygen through the umbilical cord. After a vaginal delivery, the newborn may be laid carefully on the mother's abdomen for skin to skin contact or wrapped in a blanket for the mother to hold. After a cesarean delivery, if the other parent or another support person is present, the newborn may be given to that person to hold. The mother can see the newborn and then hold the baby after the cesarean section is finished. The doctor or midwife examines the newborn for any obvious abnormalities or signs of distress. The newborn's condition immediately after birth is recorded at 1 minute and at 5 minutes after birth using the APGAR score. So basically, when a newborn comes into hands of medical personnel or healthcare professionals, they assess the baby, they clear the mucus from the mouth, nose, and throat, they clean its mouth, nose, and throat so that the baby is able to breathe, uh, and they assess the baby for any kind of defect, and they try to give first aid to the baby if the baby needs any kind of first aid. The doctor or midwife examines the newborn in detail, and in that examination, at 1 minute of the life of the baby, there is a scoring called APGAR score, which they perform on the baby. So basically, this scoring tells about the condition of the baby. So a score of 7 to 10 is considered normal, 4 to 6 is considered intermediate, and 0 to 3 is considered low. A low APGAR score is a sign that the newborn is having difficulty and we need extra assistance with breathing or blood circulation. Once the newborn is stable, the nurses obtain the head circumference, weight, and length. So keeping a newborn warm is critical. As soon as possible, the newborn is wrapped in lightweight clothing, which is called swaddling, and the head is covered to reduce heat loss. And so, what is APGAR score? We need to understand what is APGAR score. So there are two APGAR scores, one at 1 minute and one at 5 minutes. So basically, what we measure is color of skin, heart rate, reflex, muscle tone, and breathing. And the scores of the all of these five parameters may be 0, 1, and 2. So color of skin may be 0. Given the score given to the color of skin may be 0, 1, or 2. Same might be the case with the heart rate. We can give the score to be 0, 1, or 2. And same is the case with reflexes, muscle tone, or breathing. So if a baby is all pink with no bluish discoloration of hands or any part of body or lips, then we give the score of the color of skin of the baby to be 2. And if the baby's body is pink but blue hands and feet are present, then we give the score 1. And if baby is pale, he or she's all blue, then we give the score 0. And in APGAR, A means appearance. So basically, we look at the baby and we assess the baby's skin color. If the baby is all pink, including hands and feet, including hands and feet. The appearance score is 2. Same is the case with the heart rate. If the baby's heart rate is more than 100, we give the score to directly to be 2. If the heart rate is less than 100, then we give the score to 1. And if there is no pulse, then the score is 0. And reflex response to stimulation of the nose by touching it with a finger or a catheter. So basically, we touch the nose of the baby, and if there is sneeze or cough, then the score is 2. And if there is only grimace or just an expression change of the face without any sneezing or coughing, then the score is 1. Same is the case with the muscle tone. If the baby is moving actively, the score is 2. If there is some bending of arms and legs but no active movement, then the score is 1. And if the baby is listless and lethargic with no movement, then the score is 0. And if the breathing is absent, then the score is 0. If breathing is irregular or slow or gasping, then the score is 1. If there is normal breathing with a good cry, then the score is 2. So 7 to 10 is considered normal. Any baby with a score of 7 or more than 7 is considered normal. 4 to 6 is intermediate. It means the baby needs assistance. There is some problem going on with the baby and we need to resuscitate the baby. And if the score is 0 to 3, the survival chances of the baby are very low and he or she needs immediate intensive care. So basically, that baby directly goes on oxygen. That baby's IV line should be maintained, and all of the neonatal resuscitation guidelines need to be followed so that the baby can survive. Because 0 to 3 APGAR score is a very low score. So, the mother and newborn usually recover together in the delivery room. Mothers who are breastfeeding put their newborn to their breast within first 30 minutes after delivery. Breastfeeding stimulates oxytocin, a hormone that helps the mother's womb heal and promotes development of the milk supply. If a newborn is cared for in a nursery, it is placed on its back in a small crib and kept warm. And how should we cut the umbilical cord? Soon after a baby is born, the catheters are placed on the umbilical cord, and two clamps are placed on the umbilical cord, and the cord is cut between the clamps. The clamps on the cord stump may be removed when the cord is completely dry. The stump should be kept clean and dry. The stump falls on its own in a week or two. Never ever pull the umbilical cord stump. it falls on its own in a week or two. So never ever pull the umbilical cord stump. So newborn screening tests and disease prophylactic measures. So after birth, the doctor or nurse does a few tests and give the newborn a few treatments to check and prevent certain diseases, including the following. Routine newborn screening tests are done such as serum bilirubin levels, blood sugar levels in high-risk cases, tests of oxygen level to rule out any kind of cardiopulmonary problem. We will discuss all of these things in detail, how cardiopulmonary problems are assessed in a newborn. Then there are some screening tests as well, such as the diseases of sickle cell anemia or thalassemia and hearing tests, etc. So basically, all of these things are done in high resource settings. These things are not readily available in low resource settings. So all of these testings and all of these fancy screening services are available in high resource settings or in developed countries. But in underdeveloped countries or in developing countries, some of these testing are done, such as bilirubin levels are easily done almost in every country of the world. Blood sugar levels are easily done in almost all of the world. Similarly, oxygen level of the baby's blood can be easily checked with handheld pulse oximeter. But there are some tests which are not routinely done in developing countries, such as hearing tests or tests for phenylketonuria or sickle cell disease or thalassemia. These kind of tests are not done in routine in our country, like in our countries like India, Pakistan, etc. These tests are not part of the protocol in this part of the world, but yes, these tests are being done in many high resource setting areas. So as we are discussing ideal scenario, so I have the obligation to tell that these tests are part of the routine screening of the babies when they are born in some high resource setting, or in some developed country. A small amount of an antibiotic such as erythromycin, tetracycline, or silver nitrate, or in some countries povidone iodine, is placed into the eyes to prevent infection from any harmful organisms that the newborn may have had contracted during birthing process when the baby passes through the birth canal. Hepatitis B vaccine is one of the routine vaccinations recommended for all children. And in Pakistan, oral polio vaccine, which is given at the time of birth, is also given to the babies along with hepatitis B vaccine. So for Pakistan and Afghanistan, polio vaccine is also mandatory. But in all other countries where polio is non-existent, only hepatitis B vaccine is given. Because all babies are born with low levels of vitamin K, and injection of vitamin K is given to prevent bleeding, hemorrhagic disease of the newborn, that disease called. So vitamin K basically helps the baby prevent any kind of bleeding disorder on day 2 or day 3 of his or her life. About 6 or more of birth, newborns are bathed. The nurse should try not to wash off the whitest greasy material. Yeah, these are the new guidelines. They used to wash the baby with soaps or detergent type of body wash, but now the guidelines are different. The nurses are encouraged not to wash off the greasy material, the whitish greasy material, which is called vernix caseosa, that covers most of the newborn skin, because this material helps protect against skin infection. Yeah, this material is protective for the baby. So instead of using soap or some body wash, use simple saline soap wet for clearing skin of the baby. And do not rub off the whitish greasy material hardly, which is vernix caseosa, because according to new research and according to new guidelines, this material has been given to us so that we get protected against skin infections. So physical examination of the newborn, this is our the most important section of today's class. So basically, me being a doctor, if I do not talk about the physical examination of the newborn, then care of the newborn, the subject of care of the newborn is incomplete. So there might be some terminologies, there might be some things which are new to you, but I have tried my best to keep it as simple as possible. But there might be some medical terminologies, and I always try to explain all of the terminologies which I use. So I hope you will find this section not that much difficult. So a newborn is usually given a thorough physical examination by a healthcare professional within the first 24 hours of life. The examination begins with a series of measurements including weight, length. Basically, weight and length are taken right after the delivery. But yeah, they can check it again at 24 hours of life or after 12 hours of life as well. So, including weight, length, and head circumference. The average weight at birth is 7 pounds or 3.2 kilos, and the average length is 20 inches or 51 centimeter. Although there is a wide range that is considered normal, but this is average. So basically it's worldwide average, including all the kids born to white parents, to black parents, to Caucasians, to Southeast Asians, whatsoever, you name it. So it is the average weight of a baby born around the world, that is 3.2 kilos, and the average length is 20 inches or 51 centimeter. So if a baby is around this average length, so he or she is considered normal. But there's a wide range that is considered normal, and these ranges are discussed in detail on percentile charts, where we discuss whether the baby is above or below the normal standard deviations. But I cannot go into the details of what percentile chart means and what are the standard deviations. Maybe many of you already know such things, but if I go into such details, it will go beyond the scope of this lecture. But in order to understand the basic average, I have given you the reference. So we come on the examination table and we start assessing the baby. So first thing we are going to look is face, and on face we are going to look at the skin of the baby. So doctor examines the skin and note its color. The skin is usually reddish, but the fingers and toes commonly have a bluish tinge because of poor blood circulation during the first few hours. Sometimes there are tiny reddish purple spots called petechia on parts of the body that were pressed during hard delivery. However, petechia on all parts of the body could be a sign of disorder as well. So if petechia are present on all parts of the body, it could be a sign of disorder. But if they are present only on pressure points, then there is no need to worry and need to be evaluated by the doctor. Dryness and peeling of the skin often develop within days, especially at wrist and ankle creases, and it is considered normal. There is a Mm, there is a condition called erythema toxicum. So this erythema toxicum is a harmless flat rash of red splotches and usually a white pimple-like bump in the middle. It is a benign rash. It is non-hazardous rash. It goes off on its own and it does not warrant or it does not need any kind of treatment. And if our parents come to you with such a condition immediately after birth or 2 or 3 days after birth or within first week of birth, then you need to reassure them. If you are a healthcare professional, then you need to reassure them that it is a benign rash which is present in almost all of the babies who are born, and it will go on its own. You need not to do anything. They may moisturize the skin of the baby with coconut oil or organic mustard oil, because these oils which are organic, 100% organic, free of all kinds of synthetic chemicals, they help the baby skin in keeping it moist and warm and healthy. So they may apply coconut oil, but it should be 100% organic coconut oil or mustard oil without any kind of added chemicals or any kind of added fragrances, any kind of added preservatives whatsoever. So basically, if you really want to use any kind of natural, then it should be 100% natural oil. Many newborns develop rash about 24 hours after birth. we've already discussed. This rash is erythema toxica, which is harmless and disappears in 7 to 14 days. Then, after assessing the skin of the baby, we come to the head and neck. The newborn's head, face, and neck are examined by a healthcare professional for any abnormality. Some abnormalities occur during delivery, other abnormalities may be caused by a birth defect. After a normal head first delivery, the baby's head may be misshapen for several days. It may appear cone shaped or flat on some sides. But all of these problems subside usually within 1 month of life. The bones that form the skull overlap, which allow the head to become compressed for delivery. Some swelling and bruising of the scalp is typical in a normal vaginal delivery due to the pressure on the baby's head during descent through the birth canal, as birth canal is a tight passage and baby's head is a wide surface. So any wide surface passing through a tight passage, it gets compressed, and the compression sometimes leaves its marks on the baby's scalp. Sometimes bleeding from one of the bones of the skull and its recovering causes a small bump on the head that disappears in a few months or sometimes in a few weeks as well. This is called cephalhematoma. And pressure during a vaginal delivery may bruise the newborn's face. In addition, a compression through the birth canal may make the face initially appear asymmetrical as well. The delivery process might also cause subconjunctival hemorrhages of the eye as well. Broken blood vessels on the surface of eye result in subconjunctival hemorrhages, and they are also formed due to the high pressure exerted on the eyes and face of the baby during birthing process. These hemorrhages are common, do not need any kind of treatment, and typically go away within 2 to 3 weeks. So all of these things are routine. They may happen, they are not dangerous, and they can heal on their own. So one major difference between hematoma and caput succedaneum is the caput succedaneum is a wide area of accumulated blood which is outside the periosteum of the skull bone. So basically it crosses the sutures, and it is usually wider in area, and it may involve half of the skull as well. But in cephalhematoma, there is only one bone usually involved, and one bone's periosteum is lifted, and blood is accumulated beneath it, and this blood gets hardened over the course of a few days, and then it starts getting resolved within 3 to 4 or 5 weeks. It completely gets resolved and the swelling subsided. So you only need to reassure the parents that this thing will settle on its own. They do not need to drain it, they do not need to cut it, they do not need to give medications. The baby's head will be okay within a span of few weeks, so they need not to worry. And then there are some problems with the face or oral area. So the doctor examines the ear and note whether they are properly formed and in the correct place. For example, low set or incorrectly formed ears may mean the newborn has a genetic disorder or hearing loss. Then healthcare professionals also examine the mouth for problems. Rarely newborns are born with the teeth, which may need to be removed, or cleft lip or cleft palate. There is the cleft lip may be unilateral, it may be bilateral, or it may be accompanied with cleft palate as well. And the neck is also examined for any kind of swelling, growths, and twisting or spasm. So basically, they examine whether the baby has any kind of problems. Then there is a condition called congenital epulis, which is a non-cancerous growth on the gums. If it the growth, this epulis, which can be seen in the lower diagram, if the epulis is less than 1.5 into 1.5 centimeter, it regresses on its own within first 6 months to 1 year of life. If its size is larger, and if it hinders in closing of the mouth or in feeding of the baby, then we need to remove it surgically as well. Then heart and lungs. A stethoscope is used to listen to the heart and lungs to detect any abnormality. Abnormal heart or lung sounds may be a heart murmur or lung congestion. I'm really sorry. I'm having a little bit sore throat. That's why I have to take water again and again. The newborn skin color is examined. A blue color of the face and torso may be a sign of congenital heart or lung disease. The rate and strength of the pulse is checked. The newborn's breathing is observed, and the number of breaths in a minute is counted. Grunting sounds or flaring of nostrils with breathing and breathing too fast or too slow can be signs of problems in the general assessment. Physicians look for apnea, tachypnea, cyanosis. Apnea is absent of breathing. Tachypnea is very fast breathing. Cyanosis is bluish discoloration of the body parts. Cardiac auscultation detect murmurs suggestive of congenital heart anomalies as well. Lung auscultation may show asymmetrical chest movement in pneumothorax or crackles in pneumonia, or be completely clear in transient tachypnea and or persistent pulmonary hypertension of the newborn. So many of these terminologies are medical terminologies, and I cannot go into the details of these things. But for our understanding, we need to look at the condition of the baby as a whole. We cannot miss the heart and lungs of the baby when we are examining it. So, if the pulses are weak, it is poor cardiac output, it might be aortic stenosis. So, basically, aortic stenosis means the aortic valve of the baby's heart blood vessels, the aorta, is stenosed. Is narrow, which means the blood cannot easily come out of the heart. And if there are bounding pulses, then there is high cardiac output. It means there is patent ductus arteriosus. So it is also a condition. Ductus arteriosus should close when the baby is born, and if it remains patent after 1 or 2 days or 3 days, then there is high cardiac output. Uh, single second heart sound, often cyanotic heart disease. In single, if there is single second heart sound, then it is present in second cyanotic heart disease. If there is hollow systolic or continuous harsh murmur, then there is a problem with the atrial septums or ventricular septums. Grade 3 or high murmurs are also pathologic. Diastolic murmurs are also pathologic. And if there is hepatomegaly, then there is left heart failure. So all of these things can be easily assessed by any skilled pediatrician who has experience in cardiovascular pathologies of the neonates as well, because sometimes you cannot easily pick all of these findings, but if you have enough clinical experience, you can judge whether there is any problem with the baby's heart or not. And same is the condition with pulse oximetry. So basically, if you apply a pulse oximeter and saturation of the baby is more than 95% without any support, without any given oxygen, then the baby is okay. The screening result is negative. Baby can be discharged. But if on first day of life the constant saturation of the baby does not go above 95% and it remains between 90 to 94%, then you need to repeat the screening after 1 hour. And if all of the results are coming below 95%, then there is a problem with the baby's vasculature. There might be some problem, and we need to go for echocardiography. And if there is any incidence of less than 90% saturation in right hand or foot, then this is a positive screening result, and you need to go for echocardiography for any kind. What is echocardiography? Echocardiography is basically ultrasonography of the heart. So basically you need to look at the heart, that why the oxygen saturation of the baby's fingers are coming low. There might be some problem with the heart, that is why saturation of the baby is persistently coming low without any respiratory cause. If a baby is having pneumonia or any kind of respiratory problem, then baby definitely the sats of the baby will not be maintained, and you need to look at the respiratory causes instead of congenital heart disease. Then we come to the abdomen and genitals. The general shape of the abdomen is examined, and the size, shape, and position of the internal organs, such as the kidneys, liver, and spleen, are checked. Enlarged kidneys may indicate a blockage to the outflow of urine. The genitals are examined to ensure the urethra, the tube through which urine passes from the bladder during urination, is open and in the proper location. So basically, we look whether the urethra is in normal location in the male adult child or in a female child. The genitals are checked to see if they are clearly male or female, and there is no ambiguity between male and female genitalia. In a boy, the testes should be present in the scrotum. In a girl, the labia are prominent because of the exposure to the mother's hormones, and they remain swollen for the first few weeks. Secretions from the baby's vagina that contain blood and mucus are normal in first few days of life. So the female child may secrete blood from her uterus due to the withdrawal of mother's hormones when she gets born. Rarely a newborn has genitals that are not clearly male or female, and that is the case which we call as ambiguous genitalia. So, and further evaluation is needed. We immediately refer the patient to pediatric endocrinologist and they assess what's the problem with the baby. The anus is examined to make sure the opening is normally placed and not sealed shut. Yeah, there are cases when baby's anus is not properly formed and it is either stenosed or it is absent in some cases as well. Then we go for the nervous system exam. The newborn's level of alertness, muscle tone, and ability to move arms and legs equally are observed. Unequal movement could be a sign of an abnormality of the nerve, such as a nerve palsy. A newborn's reflexes are tested using various maneuvers. A newborn's most important reflexes are the Moro, rooting, and sucking reflex. So all of these reflexes are assessed in the newborn, and if a newborn nervous system is normally developed and he or she is not suffering from any kind of neuronal damage or any kind of cerebral problem, then all of the reflexes should be elicited easily. So Babinski reflex is elicited when the bottom of the foot is stroked, the big toe bends back, and the other toes fan out. And the rooting reflex is when baby's mouth is stroked from the sides, the baby will open their mouth and this helps with the feeding. And then there is Moro reflex, which is also called startle reflex, triggered by a sudden loud noise or movement. For example, if you are holding the baby in your hands and you suddenly move your hands towards the downside, as if the baby is going to fall, the baby's hand will fan out like that, and the baby's legs will flex. He will flex his legs, he will touch the legs with his abdomen, and his hands will fan out. This is normal moral reflex, and it should be present in a healthy newborn child. Then there is sucking reflex. If you touch the hard palate of the baby, if you put your finger or any kind of nipple inside the mouth of the baby, he should start sucking it. Then there is tonic neck reflex, which is normal for the babies. When an infant turns their heads to one side, the legs and arms will extend while the leg on the opposite side will flex. So this is also a normal reflex and it should be present. All of these reflexes are sometimes called as primitive reflexes as well, because these reflexes disappear when the child starts to grow beyond 1 or 2 years. So the palmar grasp reflex is whenever you give your fingers into the palm of the baby's hand, they grasp it tightly. So this reflex should be present in a healthy newborn baby. And if there is absence of palmar grasp reflex, then there might be some problem with the muscular strength, or there might be some musculoskeletal problem with the baby as well. Of all of these six reflexes, the most important one are Moro reflex, rooting reflex, and sucking reflex. They should be present in all of the healthy newborns. There are muscles and bones and joints. The newborn's flexibility and mobility of arms, legs, and hips are examined to see whether the newborn has dislocated a hip or broken any bones during delivery. Yeah, there are some instances when the bones can be broken during delivery, such as the collarbone or the clavicle bone, which is present between the chest and the shoulder. Then, so the collarbone is the most common bone that may break during delivery and usually heals completely within a few weeks without any problem. All limbs and joints are checked for unformed or missing limbs, the spine, and examine for defects or deformities such as spina bifida. So, if there is no problem with the spine, then it is considered a normal spine. If there is absence of some of the vertebral spines, then it is spina bifida occulta. If there is a swelling on the back of the baby, but there are no neuronal tissues coming out, then this is called spina bifida with meningeal only. Meninges are outside, but the spinal cord is not outside. But if the spinal cord itself is coming out, then it is called myelomeningeal C. Care during
Dr.
first
Khan,
few days after birth.
I noticed that we are still in section 7, and from your outline, there are 9 sections, and we have about
Where
10 minutes to go.
okay. I will
All
just
right.
end it up. It was the most important section, and the next sections are not that much lengthy. I will just finish it up, sir. So, care during the first few days after birth. So basically, many hospitals and other organizations offer teaching to parents about how to feed, bathe, and dress a newborn baby and become familiar with the baby's activities, cues, and sounds. Parents also are taught about routine aspects of care regarding the umbilical cord, circumcision, skin, urine, bowel movements, and weight. So basically, before discharging any baby, if a baby is healthy and if a baby is normal, there is no problem with the baby's health, and the baby is being discharged along with the mother, then most of the organizations and hospitals offer teaching to parents about how to feed, bathe, and dress a newborn baby and become familiar with the baby's activities, cues, and sounds, so that they are ready for some of these normal things which I'm going to tell in our this section. Parents are also taught about routine aspects of care regarding the umbilical cord care, circumcision, skin, urine, and bowel movements, and weight of the baby. Umbilical cord care. A newborn usually has a plastic cord clamp on the umbilical cord. The clamp may be removed when the cord is completely dry. No attempt should be made to pull on or remove the umbilical cord stamp on by us, because it will fall off on its own in a week or two. The umbilical cord stem should be kept clean and dry. There is no need to apply alcohol or other antiseptic solutions to the stump once it dries off. Circumcision is in male newborns, if desired, religiously or medically, is usually done within first few days of life. There are few medical issues that require circumcision. Sometimes there is an unusually tight foreskin, which is called phimosis, that is obstructing the flow of urine, and circumcision must be done to remove the obstruction. Although circumcised males also have a low risk of urinary tract infection, these risks can be minimized in uncircumcised males with proper hygiene as well. Also, circumcised males have a lower risk of cancer of the penis, but this is a rare cancer. Then there is skincare. Most newborns have a mild rash sometime during the first few weeks after birth. The rash usually appears in areas of the body wrapped by clothing, and this rash tends to disappear without treatment. Applying lotions or powders, using perfume soaps, and putting a cover over diaper that does not allow moisture to dry are likely to make the rash worse, especially in hot weather. The most important thing to see in a newborn and during the first 7 days of life is jaundice. Newborns may develop a yellow color to the skin, and that yellow discoloration of the skin is called jaundice. After the first few days of life, jaundice occurs because the newborn's liver needs to shift from functioning inside the womb to functioning outside the womb. However, jaundice that appears before 24 hours of age is of particular concern. Doctors usually do a blood test to measure the level of bilirubin, which is the main pigment in bile. If the level of bilirubin is above a certain number, treatment with phototherapy is begun. In phototherapy, the newborn is placed without clothes under special lights to break down the bilirubin so it can be eliminated. So basically, if a child is having jaundice and the jaundice is mild, the child can be kept at home with proper hydration of the mother and proper breastfeeding guidelines. But if the jaundice worsens, then the child needs to be admitted to the hospital. And there is a term called phototherapy, which put the baby in blue lights, which are ultraviolet radiations, and these ultraviolet radiations will eliminate the bilirubin, becomes white, and the baby becomes so kidneys are able to secrete that broken bilirubin due to the blue light. So basically, that is called phototherapy, and child needs to be admitted into the neonatal nursery ward if the jaundice worsen. Then urine involved, the patient is basically guided about urine involvement. Infants lose 5% of the birth weight during first few days of life. So yeah, that's natural. Babies lose weight during first 10 days of life, and then they start gain weight after first 7 to 10 days of life. And newborns return to their birth weight in about 2 weeks if they are breastfed, and in about 10 days if formula fed. After that, they should gain about 20 to 30 grams each day for the first few months. Infants generally weigh twice their birth weight by about 5 months of age. Yeah, by about fifth month, the infant's weight gets double of their birth weight. Then discharged from the hospital. In United States, infants are commonly born in the hospital and discharged within 24 to 48 hours. Infants who are discharged within 48 hours should have a checkup with the healthcare professional within 2 to 3 days, as we already know. And the patients and the parents should be guided about constipation, poor feeding, diarrhea, or jaundice. If they see any kind of this problem, they should come back to the pediatrician immediately. Before the infant is discharged, the patient are given specific information regarding when to call the pediatrician's office. For example, patient parents should immediately call the pediatrician if the infant has fever, respiratory problem, loss of appetite, bilious vomiting, or any bluish discoloration of the skin. So they should go back to the hospital immediately if any of these signs appear. Pets should not be allowed to come near to the baby. Keeping pets away from the baby during first few weeks of life is advised. Then feeding of newborns, the amount of feed consumed by a child varies from day to day. These minor variations are common and should cause the concern. If the child starts showing signs of any illness or has changes in growth, newborns normally lose a little weight right after birth, as we have already discussed. Doctors recommend placing the newborn at mother's breast immediately after birth. If this is not done, feedings are begun at least within 4 hours after birth. Formula feeding is also an option but should be considered only when breastfeeding is not possible due to any cause, because nothing can replace the importance of mother's milk for the baby. Most babies swallow air along with the milk. Babies usually cannot burp on their own, so a parent needs to help. Babies should be held upright after feeding, leaning against the parent's chest, and their back should be patted or with their head against the parent's shoulder, with the parents patting them gently on their back. The combination of patting and pressure against the shoulder usually leads to an audible burp in the baby, often accompanied by spitting up of a small amount of milk, which is normal in this age group. So burping is very important after every feed, because if we do not make them have burps, then it causes flatulence and baby keeps on crying. Time to start solid foods depends upon the baby's needs and readiness. The WHO and American Academy of Pediatricians recommend exclusive breastfeeding for about 6 months, but the guidelines are not that strict worldwide. Other organizations suggest parents introduce solid food between 4 and 6 months of age. In my clinical practice, I advise solid foods not at 4 or 6 months, but at 5 months of age, and I have found it very handy to remain in between the European guidelines and American guidelines. So Americans say exclusive breastfeeding for first 6 months of life, and some guidelines say you can start after 4 months. But in my clinical experience, I tend to start after 5 months of age, and I have found it very satisfactory. Signs that a baby is ready for solid foods include good head and neck control, ability to sit upright. You will be able to understand whether baby is able to take solid foods or not, because they will want to eat anything in your hand, and you will start to understand that they are ready for solid foods. So benefits of breastfeeding are very important. Breastfeeding is good for the mother and the baby. Breast-filled milk provides the baby with the necessary nutrients, and it also contains antibodies and white blood cells that protect the baby against infections. The first milk the mother produces is a thin yellow fluid called colostrum. Colostrum is a particularly rich in calories, protein, white blood cells, and antibodies, and it should be um, made readily available for the baby. The breast milk that is produced after colostrum helps maintain the correct pH of the stool and proper balance of normal intestinal bacteria, thus protecting the baby against diarrhea. Because of protective qualities of breast milk, many types of infections can occur less often in babies who are breastfed than the formula-fed babies. Breastfeeding also seems to protect against the development of certain chronic problems such as allergies, diabetes, obesity, and Crohn's disease in the long run. Mother also benefits from breastfeeding, but due to shortage of time, I cannot read it aloud. You people can read it later. Breastfeeding tips. We already discussed these tips in previous class, so I will not go into further details. Then some common neonatal problems. So first problem is vomiting. Vomiting on first day is due to irritation of stomach by swallowed amniotic fluid. Vomiting soon after feed is due to faulty technique of feeding. The proper advice regarding feeding and burping process must be important to all mothers. So if they are able to give birth to their babies after giving every feed, the problem of the vomiting settles on its own. But if the vomiting worsens or if persists after every feed with mouthful of vomiters, then they should immediately call their pediatrician. Then constipation is also a problem, especially in formula-fed babies due to casein curds. So the constipation is best managed by frequent breastfeeding. Organic causes include Hirschsprung cretinism as well. So if a baby is suffering from Hirschsprung disease or cretinism, they can remain constipated, but otherwise, only formula-fed babies are prone to constipation. The less casein in babies should be avoided. Then there is a problem with the diarrhea. So babies cause 2 to 6 times golden yellow, sticky, semi-loose stools due to high content of lactose. Diarrhea may also occur due to unhygienic feeding practices, overfeeding, bottle feeding, or serious underfeeding. Other causes can be septicemia, necrotizing enterocolitis, or phototherapy. Acute infective diarrheal diseases can be treated with IV fluid therapy and antibiotics. Then there is a problem with excessive crying. Whenever a baby is crying excessively, you need to find out what is making the what problem and the baby is suffering from. This may be due to unpleasant sensation of full bladder before passing urine. There are some maneuvers when you can help the baby pass urine, such as putting cold water, pouring slight drops of cold water over the bladder area. The cause of cry should be identified and eliminated. Painful evacuation or hard stools are also a problem. Or mere soiling by urine and stools is also a cause of excessive crying. Excessive cry may also be due to meningitis, abdominal colics, trauma, or otitis media. So, if you are unsure about the cause of the excessive cry, you need to call out your physician or pediatrician right away, because there might be a condition as devastating as meningitis as well. Evening colics are also a problem. So basically, the burping should be important. There are some chamomilla oils, some drops in containing chamomilla and things like that. So they also help in relieving the colics of the babies. Then there is excessive sleepiness. You do not let the baby sleep excessively, especially if they are not feeding well. During the first few days, neonates go to sleep after taking only few sucks on the bottle or breast. The baby should be kept aroused during feeding by tickling on the soles or behind the ears. Baby can sleep for 18 to 20 hours a day, but they should keep on feeding properly. If they are not feeding properly, you need to make them feed properly by not letting them sleep with breast in their mouth. Then there are hiccups and sneezing. They are mostly due to distension of stomach or problems like that. They are not that much important related to the morbidity. Then there is napkin rash, which is very important. The bottom of the baby should be cleaned gently with wet cotton and kept dry and exposed to air as well. The problem with the napkin rash is we always keep on applying diapers and we do not give the exposure to the air, and the problem worsens. Application of soothing ointment or coconut oil also provides relief. So basically, if the rash worsens, then you also need to apply zinc ointments as well. But there are some guidelines such as coconut oil or organic mustard oil, etc. So these things are soothing oil-based ointments as well. They usually do not let the rash develop. Then holding spells usually are present in older children, but they may be present in a child with congenital heart disease. So if a child is suffering from some breath holding spell, then you need to consult your pediatrician for a suspicion of congenital heart disease as well.